senior advisor in our college, and before that, she has a wide experience in the field of physiotherapy. She is working since 1979, and she is the pioneer of our physiotherapy. And she had worked many good work to bring our council in our Gujarat. So clap for her. In past, she was ex-principal of Vyas Hospital. Then after, she worked as a HOD in IKD Hospital, and then after Changa. And she projected nearly 40 colleges to bring in our Gujarat the physiotherapy. So clap for her. So without wasting much time, I would like to request Dr. Neeta ma'am to come on the stage and talk on the breast cancer awareness. Thank you.
સલત થઈ જઈએ એવું નથી. કેન્સર હવે તો ઇફ યુ ડાયગ્નોસ અર્લી ઇટ ઇઝ કમ્પ્લીટલી પ્રિવેન્ટિવ. અને કદાચ ને જો એવું થાય કે તમારું કેન્સર ડિટેક્ટ થયું, કયા ગ્રેડમાં થયું, તો બી એની અત્યારે ટ્રીટમેન્ટ સાયન્સ એજમાં એટલી બધી સારી થઈ ગઈ છે કે યુ કેન સર્વાઈવ અને ક્વોલિટી ઓફ વિથ ગુડ ક્વોલિટી ઓફ લાઈફ. ખાલી એક જ છે, એઝ અ ફિઝિયો વોટ ઇઝ અવર ડ્યુટી એ હું તમને કહીશ. અને હું ડિટેલ કેન્સર એટલે સ્ટેજીસ કહીશ, પણ ડિટેલ એનું એટલે મેડિકલ સાઇડ ઓછું બોલીશ અત્યારે, કારણ કે સ્લાઇડ શોટ તો વધારે મજા પડે. પણ કેન્સર એક એવા સેલ છે કે જે એની જાતે જ અંદર ડેવલપ થઈ જાય. It can be hereditary, it can be due to lifestyle, it can be due to any cause also. બરાબર? એટલે એવું જરૂરી નથી કે તમારી લાઈફસ્ટાઈલ જેવી હોય. ઓબેસિટી નંબર 1 ઇઝ ઓબેસિટી. એ લોકો ગણે છે કે ઓબેસિટી ઇઝ ધ મેઇન ફેક્ટર નાઉ ફોર causing this cancer, and that too a breast cancer. So remember that never gain your weight. વજન વધારવાની કોશિશ કરશો જ નહીં. બી એક્ટિવ એવરી ટાઈમ વેરેવર યુ આર ફીલ એની એટલે કેન્સર માટે સૌથી પહેલાં એટ ધ એજ ઓફ 30, આઈ વુડ સે એટ ધ એજ ઓફ 30 or 35, એવરી વિમેન એન્ડ નાઉ ઓલ્સો મેન. હવે એવું નથી કે મેનમાં પણ બ્રેસ્ટ કેન્સર, હવે મેન ઓલ્સો આર હેવિંગ બ્રેસ્ટ કેન્સર. So after the age of 30 or 35, everybody should go for mammography and sonography and pap smear for female. So if you are there in your society or your relatives, or if you know that in your family, your grandmother, your masi, your foy, anybody had cancer, whether it was breast cancer, it was cervical cancer, any cancer, please go for mammography at the age of 30. That will prevent you, and then every 6 months you have to go on for follow-up. So please take in the mind, if you have any family history, you should go for mammography after the age of 30. Easy way going. Okay? So please take this in your mind. You can create an awareness in your society too, that if you are above this age, if you have a family history, please go for mammography so you can prevent people from going to cancer. You might walk in some hospitals. ધારો કે કોઈ પેશન્ટ તમારી પાસે અહીંયા ડાયગ્નોસ થઈને આવ્યું છે કે એને કેન્સર છે, વેધર ઇટ ઇઝ બ્રેસ્ટ ઓર કયું સ્ટેજ છે એ બહુ ઇમ્પોર્ટન્ટ છે. વિચ સ્ટેજ 1, 2, 3, 4, there are 4 stages. આ બધું થોડું ડિટેલ કાં તો તમે વાંચી લેજો બુક્સમાંથી. આઈ એમ સોરી, એ મારી પાસે અત્યારે ડિટેલ નથી, અદરવાઇઝ આઈ વુડ. It depends on which stage it is. Stage 1 is simple. It is type of benign tumor. which can be removed and it can be you are out. But એ પછી બી તમારે every 6 months you have to go on follow-up for mammography and sonography to prevent. કદાચ થઈ શકે. Okay. Second stage is carcinoma. It has spreaded up to where level it is spreaded, you don't know, because it goes via lymph nodes. So it can spread to through your axilla, through your inguinal, to liver, lungs, anywhere. Okay. Same is second stage and third stage are nearly equal. Fourth stage, it is like on terminal range. Guys, if it is total mastectomy, then do with deep breathing and bit of shoulder elevation and depression. Then afterwards, third day, fourth day, we start with shoulder movements, deep breathing, till they start their chemo. Okay. But prior to chemo, we have to make sure that we have to motivate them, because we are the person who is going to stay with them till they complete their treatment. So as a physio, we motivate them, we tell them to eat good diet, and if they are happy, with patient, we have to motivate their family also. Because many times family support is not there, the patients are not motivated and then they feel depressed, they don't try to eat properly, and then when chemo starts, it becomes a problem for them. Okay. And frankly speaking, the main support is of a husband to wife. Okay. So remember that you should counsel the husband too, that whatever, whether if they have done total mastectomy, might be many times there are patients who don't go for plastic surgeries. They remain as what they are. And many times some women, they go for plastic surgeries, but then it is very painful. So when they have not taken any plastic, they have not gone for any plastic surgery, it is our duty to counsel the husband that please, you support her in, because it will become a social stigma for the women to be in the society. Okay, so it is we who help the patient by supporting her and counseling the family and husband. So please remember that. You will do very good work if you help like this for a woman who has undergone this breast cancer surgery. Okay. Then during chemo, it is very important to go for low aerobic exercises, deep breathing, diet. This is very important. If they will do all these things, if they will do aerobic exercise, if they will have good diet, the side effects of chemo will be less. Many times it happens that if we give them a good exercise program, when the chemo is given, there are chances of HB coming down, your total counts coming down, and the side effects of chemo is nausea and vomiting. Okay, so if proper diet is being taken prior, then hemoglobin level will not go that much down. Their counts also will not go that much down, because if they are positive, if they are active, they can work and they can do everything what they were doing prior. So please take care before of their diet and exercise program before the chemo starts. During chemo also, we have to be with them, we give them exercise, we ask them whether they are taking the diet properly or not, all these things. Once the chemo is completed, then comes radiation. It depends. Many times in total mastectomy, radiation is not given, sometimes it is given. But where the conservative treatment has been done, lumpectomy, radiation is there. For radiation, again, they have to go under some mental stress, because for radiation, their CT scan is done, their MRI is done, and then they compare it where it is. So they prepare a cage in such a way that when the radiation is given, the radiation does not go out of that area. Because of radiation, there are chances of burns. Okay, so it is very important for them also. So for radiation, we have to make patient that they get full range of motion, because they have to keep their arm in this way to take a radiation. Because there are chances their lymph nodes are removed. How many lymph nodes are removed? You never know. Depends upon the lymph nodes positivity. When they are doing the surgery, they see the area. During surgery, they go on taking out the part. They send for frozen biopsy, and then the biopsy report comes. If it is normal, then for that much area they stop. Then they go for dissection of lymph nodes. 1, 2, 3, 4, 5, whatever lymph nodes are positive, they take out. Then what they do? 5 lymph nodes, after that positive lymph node, they take it out. So it is like they prevent. Might be a small point has gone somewhere, so they take out all the. And what is the importance of lymph nodes in our body? Drainage. So if lymph nodes are removed, drainage will not be done properly. Okay. So what happens? Post-operatively, again one complication starts, and that is lymphedema. So lymphedema, if started, then it becomes a problem for a patient, because the drainage is not there, and edematous itself from day one. We give them position, we tell them that you have to do these many things, you don't have to do these many things. They can't carry a weight on that limb. They can't check BP on that side. They can't take any injection, intravenous or muscular, on that side. They cannot wear any ornaments on that side. So there are so many do's and don'ts for these patients. Okay, I was talking about radiation. When the radiation starts, it is given on specific area. Then what happens? So થયું ત્યાં કિલોડી છે એ જે રેડિયેશન જે મસલ્સ પર એનું આવે ને ડાયરેક્ટ ત્યારે એ મસલ્સ છે ને ફાઇબ્રોસ થવા માટે within 1 or 2 days. So they have that bend type problem during the radiation. So what we have to do as a physio, we give them stretching exercise. Suppose they have taken radiation, because radiation is taken for 5 days continuously. So for 3 to 5 hours you don't touch patient. You cannot touch patient. Okay. But after 5 or 6, because it happens that if he has taken the radiation at 6 in the evening, up to 10 or 11 you cannot touch the patient. But then you teach patients that they have to stretch their arm in all the ways. Flexion, abduction, adduction, all shoulder movements they have to do and stretch it. So bend is not formed, and then because of that bend also many times lymphedema occurs. So it is a physiotherapist who helps them to prevent this bend forming also. And during radiation also same deep breathing exercise, diet, because radiation also causes lowering of total blood counts. So for diet, exercise, it is the physiotherapist who helps in total management of this. Prior it was not done here. In India, prior, even when we were studying, we were just taught that you have to do some shoulder movement. But this was not known. And there were patients who were dying because of lymphedema. કારણ કે lymphedema થાય ને એટલે પછી એનું કોમ્પ્લિકેશન થાય ને એમાંથી સેપ્ટિસિમિયા થાય ને સેલ્યુલાઇટિસ થાય ને કેટલું બધું થાય ને એનાથી પેશન્ટ્સ of complication patients were dying. It was not because of cancer. Okay, so that also you have to bear in mind. That is why it is very important to prevent lymphedema. Number 1. Number 2, we have to advise patients that when they are traveling, whether it is by train or car or flight, they have to wear a compression garment. Because when there are chances of pressure changes, again lymphedema can occur. There was one patient from Dubai. Vinny, you had seen that patient? Dubai wala in VS. That was because of flight. She had developed lymphedema. She didn't knew, and she was often on flying from Ahmedabad, Dubai, Ahmedabad, and she developed lymphedema. When we came to know the history and reason, then we treated her, she was fine. So always this is very important when they are flying or even traveling in car or bus or train, they should wear compression garment. Then for ladies, if possible, they should not go for waxing, pedicure or manicure. Depends where if they have cervical cancer, they cannot go for pedicure. If it is a breast cancer, they cannot go for pedicure and waxing. Because if the vaccine is done and if the hair is removed from somewhere and if they start some infection in there, again it enhances the lymphedema problems. Okay. So in general, as a physio, it is our duty if we are working, if you will work in some hospital or somewhere or in future, I don't know, because now there are so many physiotherapists, they want to do that LANA course of cancer rehabilitation, and then they are working privately or they are working in the hospitals. As you know now, there are 3 to 4 cancer hospitals in Ahmedabad. So now they have started taking these type of physiotherapists where they help patients. Okay. So as a physio, it is our duty how we should help all the patients, cancer patients, to have a good quality of life and they can be normal. But before that, it is very important that we bring awareness in ourselves and in our society that we don't have any patients. We try to see that we don't have any patients in future, because now recently I've seen breast cancer patients at the age of 35, which is very shocking. So our lifestyle modification is very important. As I said, no obesity, so no fast foods, nothing. Second, we should have exercise regimen every day. When you are a student now, but at least you yourself just try 15 minutes walking every day. Just simple. તમે 15 મિનિટ રોજ ચાલવાનું રાખો. તમારા પેરેન્ટ્સને કહો તમારી સાથે ચાલે અને પછી એની આખી શું કહેવાય ઇફેક્ટ જોજો. તમે કદાચ ખાઓ પીવો, હું ના નથી પાડતી, ખાઓ પીવો બરાબર છે, મજા કરો, પણ એટ ધ સેમ ટાઈમ તમે એ કેલરીઝને બંધ કરી દો. સો યુ પ્રિવેન્ટ સો મેની પ્રોબ્લેમ્સ ફ્રોમ દેટ. બટ ફોર કેન્સર, ગઈકાલે જ એટલે અમારે એક ડિસ્કશનમાં આવ્યું હતું કે 5 points, main 5 points is, number 1 is obesity to prevent cancer, breast cancer and cervical cancer. Second is your diet. Third is your lifestyle. આ મેઇન 3 ઉપર એ લોકોએ એટલું બધું ડિસ્કસ કર્યું ને કે જો if we want to prevent this type of diseases, we have to see this, and main for breast cancer we have to prevent ourselves from obesity. We have to have a good lifestyle and we have to have good diet programs. Okay, so this was in nutshell. I have tried to just tell you, but remember one thing, that prevention is better than cure, because cancer treatment is very, very expensive. Government still in India has not given any incentives for this type of programs. So it is our duty, if we can prevent it, it is better. So you yourself take care, of your family and your neighborhood everywhere. Try to prevent this message that please, if you are about this, but one thing I just forgot, that you yourself can examine at home, palpation at home for lumps in your breast. So, I'm sorry. એવું હશે ને તો I'll share videos with you how to palpate yourself whether lump is there or not, deeply, superficially and deeply. So you also learn by yourself, teach your relatives, teach your neighborhood, try to take classes like that in your society, that please you can prevent yourself from this cancer, but you have to be aware how you do examination and how you palpate. That will really help the society to prevent oneself from cancer. Okay? Thank you. And if you have any questions, enjoying, and that is because support of the family and your friends and colleagues. So you as a physio always be positive for any patient. Cancer नहीं, તમારે કોઈ બી પેશન્ટ તમે ટ્રીટ કરતા હો, ક્લિનિકમાં હો, બહાર હો, વિઝિટમાં હો, ક્યાંય. And even you should help your parents who are at this age. બરાબર?
અત્યારે આ બીકોઝ બ્રેસ્ટ કેન્સર અવેરનેસ મંથ ચાલે છે, બહુ બધી હોસ્પિટલમાં ફ્રી સ્ક્રીનિંગ છે. તો એટલીસ્ટ આઈ રિક્વેસ્ટ કે તમે તમારા મમ્મીને એટલીસ્ટ લઈ જાઓ ફ્રી સ્ક્રીનિંગ માટે, દરેક જણ.
મેમોગ્રાફી ઇઝ અગેન પોસિબલ. એના માટે મેં એવું કીધું છે કે તમે સેન્ટર્સ બધા જે એરિયા છે ત્યાં મેમોગ્રાફીનું પણ એટલીસ્ટ 300-400માં થઈ શકે એવી પરિસ્થિતિ કરે તો બધા કરાવે. આ ચાલી રહ્યો છે અમારો એક ઓનગોઈંગ પ્રોજેક્ટ, એના માટે પણ કોઈક એમ્બેસેડર.
આયુષ્માન કાર્ડ ઇઝ ઓલ્સો
આયુષ્માન, હા, એટલે આ બધા
પ્રાઇવેટ્સમાં બી છે, અપોલોમાં ને બધે ચાલુ છે.
એટલે પણ તમે એમ્બેસેડર બનો ટુ પ્રિવેન્ટ ધીસ. We can do it. Okay? Thank you. આ મારો સપોર્ટ જોયો. ઓલવેઝ આઈ હેવ સીન કે મારા ફેકલ્ટીઝ ને મારા સ્ટુડન્ટ્સ જ મારા સપોર્ટ છે ને એ લોકોના વિશેષથી જ હું આઈ એમ ધીસ મચ